Is he calling for me, Val?
Yes, Ryan and Craig are trying to get back in.
Oh, yeah. I added it.
I made it in.
Step away for a second.
Okay, Tribal Council, I'll call us back to order at 14:50. Madam Attorney Bear Eagle, ni watch there.
Okay, I'm gonna hang up.
Hello, we're still, we don't have it completed. We're still going through ordinance number 16-22. I just got off the phone with the Attorney General to figure out which portions need to be addressed. So we're going to need a little bit more time to come up with the drafting, but we do have, we have identified the portions. It's going to be an ordinance amending 1622, and there's going to be various sections throughout, because the way 1622 is written is that the definition of controlled substance means any drug that's on the that's under the Controlled Substances Act, and then possession of any drug is a prohibited act. So we'll need to go through and identify these different sections. So we're working on that now.
President, can we keep moving till bring it back?
Yeah, I just won't be able to acknowledge any more motions until that's done because I already acknowledged the motion in the second.
Oh.
Mr. Chairman, this is Russ.
Yes.
Mr. Dillon had stated that we do this and bring it back within 30 days or when the next council meeting is. Isn't that what his motion is? Because I think for us to do it properly, I think that's what we need to do instead of trying to do this within 5-10 minutes. That's just an opinion.
Was that the intent with your motion, Councilman Dillon?
Yeah, I wanted something done. That's why I brought this up today, because we've been waiting on this for a long time, and I feel that people were dragging it along. If we can get something done in the next 30 days and put Ricky and them back in charge of this so it can go forward instead of being dragged along, I'm for that. And in fact, I'll change my motion to that point. But I'm tired of waiting because I get calls and get chewed out all the time. And if we can put that on the next month's agenda, first item to be addressed, then I'll make that motion now. I'll change my motion.
Okay. Councilwoman Janis, are you okay with that?
No, I'm not, but we get any other ordinance done in, a while, but I don't know why it takes so long for this one. I mean, I hate to see it like the other alcohol referendum vote that was done years ago, where the tribal council didn't even pay attention to it anymore. And I just don't want to see that happen to our people out there again, because they all went out and voted faithfully and thinking we were going to address it right away, and we're still waiting. So, and I think that we can do another 30 days, but we need to have it moving. And if he's going to include that it go back into the fifth member's office in his motion, is that what you're doing, Craig?
Yes, it is. We need this done.
Just do it, Val.
I did. I second his motion.
Okay, so that we can move on. I agree with that.
Okay.
And Mr. Chairman, it's going to be the first on the agenda. That's part of my motion.
For the October session?
Yes.
Oh, okay.
Okay, so I got a motion and a second. Madam Secretary, call for the vote, please.
Wayne Yellowhawk. Wayne Yellowhawk. I cannot clarify your vote. Duane Yellowhawk?
Yes.
Garfield Apple?
Yes.
Glenn Gibbons? Lydia Bearkiller?
Yes.
James Cross?
Yes.
Sonia Little Hawk-Weston?
Ah,
Vincent Two Lance?
yes.
Craig Dillon?
Yes.
Valerie Janis?
Yes.
Ryan Jumping Eagle?
Yes.
Bo Little White Man?
Hold on. I just got back on. What are we voting on?
This is a motion to decriminalize the possession of the recreational marijuana for less than an ounce at the age of 21. For them to, the attorneys to amend the ordinance and give it back to the fifth member's office and bring back to the October agenda to be the first on the agenda, first item on the agenda.
Okay, yeah.
Chancy Wilson,
No.
Phillip Goodcrow,
No.
Randy Laysbad, Randy Laysbad,
My vote is no.
Richard Greenwald.
Yeah.
$11 yes, 3 no, 1 not voting.
11 yes, 3 no, 1 not voting. Motion carried. Thank you, Tribal Council. Mr. Fifth Member, anything further for your report?
Global Hilo, Wopila Tanka Ila Chichapelo, Doxa, 30 days while will premanger Mitroka Aoktelo. 30 days, we'll see you, Council, and thank you for your votes. Have a good day.
Motion to approve. Fifth member's report.
Got a motion to approve and a second. Is that Councilman Apple that second that?
You went.
Yes.
Madam Secretary, call for the vote, please.
Duane Yellowhawk,
No.
Garfield Apple,
Yes.
Glenn Gibbons, Lydia Bearkiller,
Yes.
James Cross,
Yes.
Sonia Little Hawk-Weston, Vincent Two Lance,
Yes.
Craig Dillon,
Yes.
Valerie Janis,
Yes.
Ryan Jumping Eagle,
Yes.
Bo Little White Man,
Yes.
Chancy Wilson,
No.
Phillip Goodcrow,
Yes.
Randy Laysbad,
No.
Richard Greenwald,
Yes.
11 yes, 3 no, 1 not voting.
11 yes, 3 no, 1 not voting. Motion carried. Thank you, Tribal Council. Moving on into the agenda, number 18, Aberdeen Area Health Service Pioneer Service Unit. Dr. Sarah Dumpenigo.
This is Dr. Jumping Eagle. Do you want me to present my screen? Or I don't know if I can.
If you have something to share, that would be great.
Okay. Okay, you'll have to bear with me because I think I did present this to HHS. So if I'll go through some of the data. Can you guys see it? I don't know how to get rid of this.
Yes.
Okay. Oh, there we go. Okay, so we're reviewing, and I'll have, once we get the September data, we'll see some significant changes, especially regarding the inpatient visits. Our ambulatory visits have been pretty steady throughout, and we've continued to work on reaching out to patients to offer telehealth visits as well. This right here is the ED visits, and you can see that back when COVID first started in this area, we had some decrease, but we've been increasing on that in that area as far as visits go. The general clinic visits, we've increased back up to our regular range, if not above, and so that's remained pretty steady. Pharmacies remain steady overall, and we believe the curbside delivery, mail out orders, all of that's been helping to keep those visits at our average amount, which is a high level. For pediatrics, we did see a big drop there back around the time that COVID was starting in this region, but we've been increasing that, and we've been seeing a fair amount of pediatric visits lately, and also encouraging reaching out to families to update vaccines and to continue to do well child visits. For dental, we did have a significant drop, and that's been creeping back up. And, you know, that's an area where it's kind of hard to offer telehealth visits, but we were doing telehealth visits as well, and that's continued. Behavioral health, that's remains pretty steady. We had a little decrease there back in April, and we've really been working with behavioral health to increase the telehealth services, which now that we are seeing increasing in COVID patients overall, I think our community will benefit from that in the long term as well. Optometry, that's another area that we've been, we implemented a process to increase our services again, and we should be seeing some significant changes with optometry within the next several months, as we have recently a new optometrist started at Pine Ridge, and we have one that will be starting in Kyle, I believe within the next month. They just accepted our offer. And then for inpatient, that's an area where we had a significant decrease in inpatient admissions and discharges. And that's an area where we're going to see a big change, because in the last month, at least for the last couple of weeks, we've been averaging 12 to 15 inpatients a day, and at least 1 to 2 patients with COVID per week on average. So this is going to change significantly in the next month. For OB and GYN visits, that's been pretty steady, and the same for prescriptions overall. Coding and billing has stayed pretty steady for coding. Billing, we are still awaiting word on our CMS certificate. So we've actually reached out again to find out the status of that, and that will allow us to bill from June 8th and onward. Some of the things we just discussed was the decrease in admissions, but we have been working with staff to review COVID protocols, to encourage admissions that are appropriate to our staffing and to our capabilities as far as the equipment that we have, and then transferring patients with COVID or other diagnoses if they require a higher level of care. And as stated, the dental and optometry visits have been improving. Things that we've been working on an ongoing basis, we've got a lot of recruitment efforts going on. We just selected and had people who accepted our offers for a pediatric position, an internal medicine pediatrics physician, as stated, the optometrist at Kyle. We also have a new midwife will be starting at Kyle as well, and a new podiatrist will be starting in Kyle, I believe, in the next 2 weeks. We have a mid-level provider who's going to be going out to La Creek on a permanent basis. So all of these things are going to increase our access for patients, and also an internal medicine physician at Pine Ridge. I know that's been a concern in the community as we've been going through a transition with our providers. Our overall goal has been to increase our permanent providers so we can decrease some of the outpatient, inpatient, and laboratory contracts as we hire more permanent staff. We've been working with our staff to improve our customer service processes, and we've hired some new MSAs who are going to be working in a central scheduling, and that they're being oriented, and that's going to be a new process for Pine Ridge as well. And we're hoping that will improve the telephone service. We've had some complaints about that in the past, and then increase the access for patients to schedule and not be as frustrated with the telephone lines. We also have, which I believe are advertised now, we have 2 COVID positions for a patient liaison and a patient advocate to help people navigate, or if they have complaints or concerns, the liaison and the advocate would help with that process. For our COVID-19 surge preparedness, we have had since, I believe, April, an ongoing twice-a-day communication process, which is basically similar to incident command, although we're not currently in incident command. We are also having additional surge preparedness meetings 3 times a week. And then I've been collaborating with the OST COVID-19 Task Force, the medical work group, OST Tribal Health Admin, OST CHR. They also work closely with our lead public health nurse, and in collaboration with the South Dakota Department of Health on contact tracing and following up on patients with COVID, and then also informing those who have negative tests as well. That goes through our PHN department. I think those are the main things on there. We did have last month a Stanford collaboration where we had a team that came out and worked with especially inpatient and ED regarding our COVID patient processes. For example, how do we move patients around in the facility and keep them under infection control precautions to make sure that we're keeping our patients and staff safe. We reviewed our equipment. We set up a mock critical care room in the surgery clinic. And this is in preparedness if we did have a COVID-19 patient surge. And similar to some of the things that were happening this past week with Monument Health being on diversion, if we had to set up a critical care unit, what would that look like? And so we demonstrated that with our staff. We assessed our inpatient, outpatient, and ED for patient flow for patients with COVID. And then we did some drills with our staff, and we had a follow-up call with Stanford, and they're also offering, if we do go through a surge, that we could reach out to them as well. And some of them would be willing to come back and help during the surge. On that note, IHS nationally has a critical care team, and that's also a research source for us. And there's a plan that they'll be coming sometime in the next month. I don't have the exact date for that. We're also working with the University of Minnesota. We're exploring a IPA agreement where we would bring in fellows who are internal medicine pediatrics and also surgical fellows. We had an on-site meeting this past month, and we're going to have follow-up meetings to discuss this further. But we're hoping that this would also help us develop a further pipeline to recruit more permanent staff, but also to increase surgical access for IHS patients, not only on the Pine Ridge Reservation, but also to put us in a place where maybe we could become like a regional surgical center. We had our Joint Commission lab survey August 3rd through 5th, and that went very well. We had some minor corrective actions. We're submitting that response to Joint Commission as we speak. Oh, and we are still expecting the full Joint Commission survey. We don't know when that's going to happen. That'll be a full hospital survey. We're not expecting that they'll show up right when we're having a surge, but it could be any day now, and we're continuing to prepare for Joint Commission. We're doing mock surveys, walkthroughs, tracers. We're continuing our community drive-through testing process, and we have had a significant increase in numbers of people who are coming through the community drive-through testing, anywhere between 120 to 140 a day. One of the challenges is, I think, in the region in South Dakota, as people in other areas are experiencing the same thing, is that the Department of Health and some of the other labs are limiting how many tests we can send a day. So we are continuing to look for additional labs that we can send out tests to. We also have a fairly limited amount of the rapid tests, and so we have updated our testing protocol based on the current rapid test availability. But also to keep in mind, there is a new test coming out soon. We don't know when we're gonna get it, but it's called the Abbott Binax Now test, and this is an antigen test. It requires a nasal swab, and there's a result in 15 minutes. So we're hoping that we will have that within the next several weeks, so that will increase our rapid testing supply. We have numerous COVID-19 positions advertised, and when I do get on the radio, we're letting people know to look at the IHS website for these positions that are advertised, and then we're also sharing the information on our Facebook page as well. We are continuing, as I said, to do the drive-through testing, and just to correct this, right now we're doing Monday through Thursday the drive-through, mainly because on Fridays it's difficult to coordinate getting the test to the state in time on Fridays. And then we have testing once a week at Wombly, Kyle, and La Creek. And patients who request testing when they come for care are also tested as well. We were just wrapping up our fiscal year and have budgets that were submitted from all departments. And then we have, with the new CDC recommendations, we've implemented face shields or goggles for certain direct care patient areas. And then the CDC is promoting non-test based strategies. So that's part of how we've updated our testing protocols. And then Abbott ID Now, they're recommending that if we do an Abbott ID Now rapid test, that the specimens have to be processed within an hour. So that change just came out this last week. So that makes it a little bit more difficult for us if we're doing outreach testing in collaboration, for example, with the COVID task force or the medical work group, that we have to get these processed within an hour. We can't store them and then test them later in the day. So that's changing how we're going to do some of the testing. For example, if we go to the nursing home or the jails, we'll have to probably do a send-out test for some of those things. We're also discussing for our types of storage that we have really limited space here at the service unit. And as we're increasing services and also the need for storage, for example, for COVID-19 supplies, we're also working on, we're going to be renovating our pharmacy to make it more patient friendly. But we're having to move medical records, and that requires additional storing requirements as well. And then I did we've been having issues where intermittently Monument Health was on diversion for several days. Diversion means that they're not able to accept transfers. So if we had patients we were trying to transfer for a high level of care, Monument Health at Rapid City was not accepting patients for several days. And my understanding was that was due to staffing issues. There were also times Tuesday and Wednesday when Sanford, Sioux Falls, Avera, and Scottsbluff were also on diversion. So we did have to send at least a few patients, for example, to Wyoming, and we were looking at Colorado also. But right now, these hospitals are not on diversion, so we're just following up on a day-by-day basis. Another challenge that we're having, and I did send an email to Ms. Janis and Mr. Jumping Eagle of HHS and Sonia Weston with a question regarding if we have patients on the weekend who require if they're having psychiatric issues and they require a mental health hold, that there currently is no process to obtain a tribal mental health hold on the weekends. So this is a challenge for us in that we still have to try to get patients to a higher level of care, but there's certain situations where we can't transfer them without the mental health hold to a psychiatric unit, especially, for example, Yankton. So I'm requesting assistance from either HHS committee or Law and Order committee to help address that question. Does anybody have questions for me?
This is John. I have a question for you, Dr. Jumping Eagle.
Sure.
Can you tell us how many folks since March have come through IHS that have required hospitalization due to COVID-19?
Yes, and I also believe the tribal health administrator has that information as well.
I look on the reports they provide, but nothing indicates, and my superiors have been asking if I can get that information, so.
I'll look it up and then I'll share that.
Thank you.
I have a question for Dr. Jumping Eagle.
Councilwoman Little Hawk-Weston.
Yeah, my question is, with the COVID related that are happening now, and we're getting these lot of cases that are coming through, probably IHS here. Some of them are, to me, are kind of serious, especially when you can't breathe. I mean, has IHS really looked at those ones and tried to at least admit them, or if you, like you said, you have to send them elsewhere for care? Are you doing that? Is IHS, we not turning people away when it comes to that point? Because I was just kind of wondering if the patients were seen and triage where they're if they do see that they're having a hard time breathing, you know, a lot of times I think that we send them home just to have them quarantined for 14 days. But a lot of times they're having difficulty breathing, and then they go into anxiety. And a lot of them, you know, that I've talked to say that they're currently feeling that anxiety. So is there, have you kind of seen cases like that, Dr. Jumping Eagle?
Yeah, and I would say that, you know, one of the things that IHS is looking at is that our hospitalization rates for patients with COVID are actually higher than, for example, the state, like South Dakota, North Dakota. And I would attribute that to the fact that we recognize that our patients have more risk factors. And we take into account the social factors. For example, does somebody have a ride? Does somebody have a phone? Do they have access to follow up? So we will tend to admit based on what their veins look or what their lungs look like, but also are they going to be able to, if things get worse in the middle of the night, are they going to be able to make it back in? And we would rather keep them here than have it become where they're getting worse in the middle of the night and having to call the ambulance, you know, or something else happening. So I think that is a difference between IHS and some of the other facilities. But we will keep patients here, and we are working on, we recently got our high flow nasal cannula equipment. We had ordered quite a while ago, but as you know, all of the supply chains everyone's trying to get the same things at the same time. And then we did request from area additional ventilators. As I've informed before, we have in the hospital 8 ventilators, and at least one of those has to be for the operating room at all times in case of emergency. So we would have 7 ventilators available for our inpatient unit. And so we've requested additional ventilators as well, and we're ordering more of the high flow nasal cannula and CPAP. Those are ways of helping people to breathe without them having to be intubated on a breathing machine like a ventilator. So, you know, most of what the standards of care we're learning from other places that have gone through this is that you try not to intubate someone as long as you can. If they end up on a ventilator, then what the data has shown is that they end up being on the ventilator for between 1 to 2 weeks. And that's part of why I believe that, you know, Monument and other places have had to intermittently go on diversion, is because of those types of challenges as well.
And are you, another question, are you guys, I was just reading the report that went out on the news. Are you, the IHS hospital, like almost filled to capacity with patients, not only COVID, but other health-related illnesses?
Right now, we are not full to capacity. We have had days where, for example, last weekend, there was one night we had to go on diversion based on nursing staffing. But we've been, like I said, averaging from 12 to 15 patients a day. And we have had the staffing to sustain that and take on additional patients if they present or if we need to. So most of our transfers, you know, right now are based on whether or not they need some type of higher level of care. Do they need a cardiologist? Do they need an MRI? Do they need ICU care where they're going to end up on a ventilator or, you know, something like that?
Okay. All right. Thank you.
Yeah. And then one other item, we are working with OST Emergency Management. We did set up, in collaboration, we set up one of the modular units outside of the, in the east end of the patient parking lot, and we're reviewing, what our process is going to be to
Madam Secretary, do I have any other hands up?
You do not.
Dr. Jumping Eagle, do you have anything further for your report?
No, thank you.
I have a question.
Yes, Councilwoman Bearkiller.
I'd just like to commend her and the reports that she did and keeping the public informed. And I appreciate the information that came out to us. Thank you, Sarah.
Wopila. Oh, also in response to Mr. Long's question, I don't have a total of how much IHS or here at the service unit has admitted so far, but those that have been hospitalized ever with COVID-19, but that includes those that we've either transferred or that have presented elsewhere but are one of our patients, is a total of 43 thus far. But that's been since April.
Thank you.
I have a comment, Chair.
Yes, Councilman Jumping Eagle.
So, Dr. Jumping Eagle, I just want the public or the people to know that you also sit on this task force, right? The COVID task force, the medical group.
Yes.
And
yes.
The decisions we make on a curfew, a lockdown, they're all based on what the numbers you guys get, the data and stuff. So I just wanted to make that known to the public that you do, as the CEO of IHS, sit on this task force and help with recommendations. You see what's going on up at IHS and the capabilities they have or the capabilities that they don't have in dealing with this pandemic. So I just wanted to make it known that you also sit on that task force and help with the decisions that the task force makes. And I just want to thank you also for the work you're doing.
Yes, thank you. Earlier in the week when several hospitals were on diversion, and we've been, although we haven't been over capacity, or we were able to handle what we had this week. It did look. I'd remind people that we had a emergency response and incident command drill in April, and that was what we did a tabletop drill on with OST emergency management, and our incident command was that all the hospitals were on diversion, and we were having an influx of COVID-19 patients. So this week was looking somewhat like that. And so, I encourage everyone to take this seriously, and that we do have limited resources here at the service unit. I described the ventilators, our other airway management strategies, and a limited number of staff, although we do have contingency plans in place to ask for additional help from area and from FEMA and from other, for example, I talked about our Stanford collaboration, similar to how UCSF worked with the Navajo Nation. So we are trying everything we can to increase the resources we'd be able to offer in the middle of a COVID-19 surge of patients. But we know that our community is high risk, and that we need everybody to follow the Oglala Sioux Tribe's recommendations or guidelines of the shelter in place, the mask ordinance, to do social distancing, hand hygiene, to limit the sizes of events such as funerals, because we know that in other places where there have been outbreaks, they've been traced back to, for example, funerals family dinners, birthday parties, gatherings. And right now we're exactly about 4 weeks after Sturgis and the Central States Fair. So we're seeing the results of some of that as well. And I really want to thank the tribe and the task force and the medical work group for all of their hard work. Everyone's been working hard and spending a lot of hours preparing because we don't want to see the worst case scenarios happen.
Thank you.
Valerie has her hand up.
Councilwoman Janis.
Thank you. I know Sarah had a question for us earlier about the mental health, and I wanted to ask the past two chairmen, how was that done in the past so that they can have? I know one time a patient was taken in and there was already an order there that was signed by a judge, so the doctor just filled it in. Is that something we need to look at to help that process? Because they can't wait until Monday or, Tuesday to be sent out. So I know that process was in place before for the mental health cases. Sonia or Sheech?
Val, I can't recall if there was anything during the time I sat on as the chair of the HHS, if we ever ran into anything like that. I don't recall that, but maybe we need to have something in place to help IHS with that. So maybe that's something we should maybe address at our HHS committee, so that we have something in place for the future.
My understanding is there is a process outlined in the tribal laws, but it's not clear how that would happen on the weekends. That's the
and that's your question.
Yeah,
that's your question.
Yes, on the weekends, we have a process in place in the middle of the week. Of course, not in the middle of the night or on the weekends. So behavioral health works pretty closely with the courts, but when we've talked with the Attorney General and the Chief Judge, we weren't able to, they didn't have a process for nights or weekends.
Okay, well, we'll address HHS.
Yeah, we can address that.
Thank you.
I'll make a motion to approve IHS report.
Second.
Got a motion to approve by Councilwoman Little Hawk-Weston, second by Councilwoman Janis. If there's nothing further from Tribal Council, Madam Secretary, call for the vote, please.
Duane Yellowhawk. Duane Yellowhawk. Garfield Apple.
Yes.
Glenn Gibbons. Lydia Bearkiller.
Yes.
James Cross.
Yes.
Sonia Little Hawk-Weston.
Huh?
Vincent Two Lance.
Yes.
Craig Dillon.
No.
Valerie Janis.
Yes.
Ryan Jumpy.
Yes.
Bo Little White Man. Bo Little White Man. Chancy Wilson. Chancy Wilson. Phillip Goodcrow.
Yes.
Randy Laisbad,
No.
Richard Greenwald,
Yes.
nine yes, 2 no, 4 not voting.
Motion carried. That concludes everything for the Financial Service Unit. Thank you, Dr. Sarah Jopenigo. Oyate Health Center, Geraldine Church.
I let you know there is no report for the Oyate Health Center.
Okay, and I don't think they're present either. Number 20, Bureau of Indian Affairs, Pine Ridge Agency, Superintendent Long. Superintendent, you gotta unmute yourself.
Good afternoon. We'll start by the general assistance for September. All payments have been made to our clients. I usually send out a text message to the council reps as soon as they're completed. At this time, the agency is closed due to positive COVID cases within the tribe and them kind of transferring over to the agency. So we're absolutely doing no in-office work this week, and obviously that's affecting our ability to get some of the work done, but ultimately I have the responsibility to make sure that my staff are healthy and safe. So as soon as we can get to a point of somewhat normal operations again and have staff coming in 1 or 2 days a week, we'll definitely start doing that again, and I'll let the tribe know. But at this point, that's the decision I had to make, was to close the agency until we had it cleaned last Friday. And then hopefully, I ain't going to say it, but hopefully we could open on Monday if everything goes well. I had some discussion with some of the council reps, and it might have been on EB&D regarding there was follow-up on the leases for the AT&T towers. Following up on that, everything's done as far as I understand it, and construction has began on those projects. Talking with my realty officer, Mr. Poirier was supposed to provide us some updated maps, and other than that, those projects are moving forward at this time. We had an issue last week. A couple of council reps were texting me regarding some road projects, and I've texted them back individually to let them know what the status was. But for everybody's information, I'll give you an update. We were working on easements for some projects out near Oglala. BIA Road 50, that has been completed and returned back to the contractors that's apparently hired by the tribe. We did get to, and I explained for BIA Route 88, BIA 90, we did not receive any official paperwork. And in fact, when we broke earlier for your break, I did go check mail, and I just received those 2 applications in the mail today. So as soon as I can get my staff back in and start working, we'll start working on those easements for those 2 projects as well. Any questions so far?
Yeah, I do. I have a question, Mr. Chair.
Yes, Councilwoman Little Hawk-Weston.
Yeah, John, I really have a concern when it comes to our leases, residential leases, and especially with our COVID numbers being high. I really, I don't know, it seems like things are moving slow right now, and through the process about getting residential leases approved, and through land committee and through going through that whole process, working with BIA, and I'm kind of just something to maybe throw out to the land committee is that, we should try to either, we're going to push these through, or, are we going to wait until this things kind of numbers start coming down? Because, people are kind of worried now. I think a lot of times as council have to sign off on those applications. And right now with the numbers, I really hate for people to be, having to go out and get different signatures and all of that. And sometimes we get those calls. So I'm kind of concerned with that part of it when it comes to safety. even as tribal council, sometimes we have to make sure we're safe, but also that we're protecting our people, our Oyate out there. So that's one item I wanted to kind of address or throw out there to yourself, as well as, the council as land committee, if they could maybe address that down the road here.
I agree, Sonia. Good point. Also, keep in mind, and I might have mentioned at the last council meeting, and I know everybody's wanting their stuff done, and I really want to get as much done as we can, but people have to be realistic in realizing that we're working 1 or 2 days a week, and now we've been inundated with over 100 easement. We talked about the easements through Golden West because folks are wanting their internet set up so they can do long distance learning or virtual learning with their kids. So that's been our priority, is to try to get those done. We've been working on those, and we haven't placed much emphasis on these new leases or these new home site leases. We've been trying to get the ones that have been in the process worked on, but in all honesty, we've been trying to get the Golden West stuff done so they can get out and get these lines connected for folks to do home learning. Okay. The next issue is our wildland fire program. Just so you're aware, we've had 242 fires so far this year. By far, one of our busiest years, probably in the last 15 or 20 years. And one of the things we're experiencing, and it's escalated to different committees, and I want to put it out just so everybody knows, okay? We implemented a new fire protection agreement for all of our BFDs across the reservation, off the reservation, and this is something that was implemented by the region, okay? And it's paid out of NISI, out of Boise, okay? So the agency has nothing to do with it. BIA at Pine Ridge has nothing to do with payment of this process. We submit the paperwork, and it goes through our PRISM and our SAMs, and people get paid electronically just like you would when you get paid from work. We've had some VFDs who chose not to sign the new agreement. And I've explained that to a few council reps, that these folks are not choosing because, for one, the language has changed, and two, the rates have changed. Now, I had a discussion a couple weeks ago or a week ago with the regional FMO to try to get some education on how this new system came into play for calendar year 20. And one of the explanations I received was the rates were so disparate between different VFDs across the region, they standardized the rate. And as I'm told, it's still better than what the state is paying. So the VFDs that chose not to sign the FPA is basically because they're wanting to dictate, or they don't agree with the rate that's being paid. And it's gone as far as some adults, quite frankly, bashing me and my staff on Facebook, which I think is totally unprofessional. It's immature and it's childish, but my position isn't going to change. If they want to fight fire as part of Pine Ridge Agency, they have to sign the FPA. All I'm doing is enforcing the FPA. I didn't write it. I'm implementing it on behalf of the region. But if they want to fight fire, they have to sign the FPA to participate with the agency. And again, it's escalated to Facebook apparently, but it's a matter of liability. It's a matter of enforcing the region's FPA. And by all means, I want every resource that we have available to be able to come out and help fight fire. But those that are choosing not to sign it will not fight fire on Pine Ridge at all. So I just wanted to put that out there because I know we're getting a lot of questions, and people are not understanding what the process is. But the bottom line is, sign the FPA, and we'll definitely utilize the DFDs that are off reservation, as much as we can. And there is a process within the FPA that can be followed, but I just wanted to make sure all of council understands that there's a process in place for utilizing those FPAs. Is there any questions? Okay, right now, one of the things we saw a really huge issue this year is the recruitment process. Our numbers are way down. What we're finding is that we get folks that will take the online testing, and then it kind of stops at the drug testing, and it stops at the training. So we've gotten approval to where we're going to, hopefully this upcoming year, if any of you remember, the fire program used to have a rookie camp every year, and we used to pay our ADs to come in for that class. So this next year we submitted a plan to the regional FMO, and we're going to pay our ADs to come back and start the rookie camp again. Because I think that's what kind of increased the numbers in years past. And we actually were paying these guys to come take the certification and get certified as firefighters. So we're going to implement the new recruitment strategy in 2021. We'll start going out again and doing, the drug testing in the, let me back up. Drug testing wasn't an issue. The issue was getting them to take the physical. So it was either once we got them to the point of a physical, then it would schedule it in Martin or Shattern or Rapid City. We didn't have any control over where they schedule those physicals, but a lot of folks had a hard time getting to those locations to get their physicals done. So we're going to try to, apparently there's a mobile bus that can be utilized, and we want to try to get that bus over here to do our physicals for this upcoming year. And I hope to eliminate, those issues of folks not being able to get their physicals done on time, because whether they take the physical or not, once we sign them up in the system, we're still billed for that physical. So we're hoping to try to get it cleaned up and get more AD firefighters for this upcoming year. Typically our season is going to end in October, and I don't see it ending anytime soon. I mean, we're in fact out on a fire right now, somewhere out near Manderson. So it's been a really busy year, and I just want to reiterate again, that if you folks have any contacts with the DFDs, reiterate my message. In fact, I've got a meeting on Thursday with one of them that I hope to resolve, the issue with the FPA by going and talk to the board and to the VFD. So hopefully on Thursday I'll get one of them resolved. But that's kind of it regarding fire. We've got multiple positions that we've hired now at the agency, which I hope is going to help increase some of the work, like Sonia said about leasing and different things. We've hired 2 positions in realty. We've got 1 in probate, 3 positions in facilities, 1 in fire. So we're definitely making some headway on some of these vacancies that we had at the agency. Any questions? That pretty much is my report at this point. As soon as I can get some clear direction on when we can bring our staff back, that's probably the priority for us right now. Is we got our building cleaned and going to try to get some folks to come back to work. But that's all I have, folks. Thank you.
Thank you, Superintendent Long. Can I get a motion from the council in reference to the superintendent's report?
Motion to approve his report, BIA report.
Motion to approve by Councilwoman Little Hawk-Weston. Second by Councilman Yellowhawk. Madam Secretary, for the vote, please.
Duane Yellowhawk. Garfield Apple.
Yes.
Lydia Bearkiller.
Yes.
James Cross. James Cross. Sonia Little Hawk-Weston. Vincent Two Lance.
Yes.
Craig Gillen.
No.
Valerie Janis.
Yes.
Ryan Jumping Eagle. Ryan Jumping Eagle. Bo Little White Man.
Nope.
Chancy Wilson. Chancy Wilson. Phillip Goodcrow.
Yes.
Randy lays bed. Randy lays bed. Richard Greenwald.
Yes.
Eight yes, 2 no, 4 not voting.
Thank you.
Thank you, Superintendent Long. Madam Secretary, that motion passed. Oglala Lakota, Oglala Sioux Lakota Nursing Home.
There is no report from them. They stated that they will report to HHS.
Okay, Councilman Greenwald, did you say something?
Do we even have quorum right now?
Secretary, roll call, please.
Jim Meeks is excused. Green Yellowhawk.
Here.
Garfield Apple.
Here.
Glenn Gibbons. He's excused. Lydia Bear Killer.
Here.
James Cross.
Present.
Sonia Little Hawk-Weston.
Here.
Jackie Sears is excused. Vincent Two Lance.
Here.
Craig Dillon.
Here.
Cora Whitehorse is excused. Valerie Janis.
Here.
Valentina Merdanian is excused. Ryan Jumping Eagle. I just accepted Ryan Jumping Eagle back on. I don't know if he's lost.
Did you get my vote? There.
Oh, Little White Man.
Here.
Chancy Wilson. Phillip Goodcrow.
Yes.
Randy Laysbad. Richard Greenwald. Nakina Mills and Robin Tapio are excused. Present, 2 absent, 7 excused.
Will we recess till tomorrow?
Yes, I did get a text. There's a huge fire out there by Councilman Gibbons' residence, so he had to leave. And Councilman Wilson texted and said he had a horse that ran through a barbed wire and got cut pretty bad. So we do not have quorum. We only have 12 present, so I'll call us into recess until tomorrow morning at 10 a.m.
President.
Yes, Councilwoman.
I'm gonna need to be excused for tomorrow because I got to take a car back.
Okay.
And I'm not gonna be able. I'll try to get on my way out, but it's going to depend on the service, probably off and on.
Okay, just text me and let me know in the morning.
Okay. All right. Thanks.
Thank you, Tribal Council. We are in recess.